So we're going to run through the root canal cart here. So we have our root canal cart. This was just reorganized, so we have our files here, and they're all labeled nicely due to one of our assistants, Mindy, who is absolutely fabulous. And we have our paper points here, so that's kind of organized. We're kind of getting into the gutta percha points right now, and I know this is all kind of probably a little bit of foreign language, but we'll have to work through that as we move on into the root canal procedure itself. But this is all organized very well here. Down here we have our extra IRM, and this is IRM and ZOE, two different types of temporary filling materials. We have some popsicle sticks here, which we use for some of our x-rays to help with the angulation. And then here we have our water and our sodium hypochlorite that we will use for rinsing the canals. Back there we have our holders for our endophiles and our sponges, and then our tips for our apex locator in the back. This is all of our rubber dam stuff here, so our rubber dams themselves. We have our rubber dam frames, and then our rubber dam clamp and hole punchers are here, and then this will help with starting off to be able to label your rubber dams when you first start off, being able to figure out exactly where you want to punch that through to do the root canal itself. Here we have our files. This is a little bit different now compared to other files that we're using, so we're still getting a little bit used to how exactly we want to set this up. But these are going to be our rotary files that we're going to use. So once she gets through kind of the hard work of the root canal itself, getting out some of that, the nerve of the tooth, we're going to go in with these rotaries and start kind of getting things smoothed out for our gutta percha points. So at this point, we'll just ask Doctor exactly what she wants until we can get that streamlined a little bit. These are extra called path files. From what I am understanding, this is in case she's having issues getting through one of the canals with the rotaries. She would utilize these to kind of break through a tougher canal. So these are just individually placed for now, and then we will work on a different system as far as getting that organized down the line. Here we have our rubber dam clamps themselves. So at first, if you're not too familiar with these, you could just ask her which size you would like. We have plenty of them. But basically, it's kind of labeled here the different sizes. So the ones that you really want to concern you with is the number 2s are a pretty common size that we'll use. Sometimes the 14s for the molars, which we're starting to do more molar root canals now. And then our anterior ones. So anything 6 through 11, 22 to 27, we would use one of these clamps here. I did print off some photos as to how to set up the rooms here, and a little bit of information. This will live on this cart, so if you have any questions as far as setup, you can refer back to this video, or you can look at this and see if that would help at all. So over here we have a lovely setup for a root canal. So we're always going to want one syringe filled with water, one filled with some sodium hypochlorite. You can keep a cup off to the side for some extra sodium hypochlorite, but from what I'm understanding now, we won't be rinsing as much with it as we have in the past, so we may not need extra there. These are going to be our fillers for our root canal, so once she is done kind of working through those canals and is ready to fill, these are two different types of materials that we're going to use. This is what is going to be your sealer, so this is going to kind of go in with the gutta percha point to seal that off, and then this is sometimes used over the top of the canal. She does not use this every time though, so it's kind of hit or miss, but have it out just in case. Here we have our cassette for the root canals itself, so we have a mirror, of course. And then your two most popular ones that you're going to use for root canal procedures are going to be your Endo Explorer, which looks like this. Is kind of similar to a Explorer. It doesn't have the curved end, so it has two kind of pointed like 45-degree angles there, so we want that one out at all times. This here is going to be for her to cut off the gutta percha point, so she's going to heat this up with the torch, so always have a torch out as well, and these are stored in the lab. So you can kind of see where the burnt end is there, so she's going to heat this up. Be careful when you're cleaning that off. What I'll do is dip a few 2x2s in a little bit of alcohol and wipe it off as she's going, but you want to make sure you're not touching this end after she has, got that nice and hot to clear that up. This is going to be what we call a plugger. So when she is done filling the canal, she's going to utilize this to just kind of push down that gutta percha point and get everything sealed up nicely. So your 3 workhorses for root canals is going to be your Endo Explorer, your burner, I guess we'll call it a burner, and then our plugger here. We do also have a little bit of a composite setup here as well in case she chooses to put the final filling in. So we have a scaler, we have a composite instrument, a ball burnisher. This is what she calls a skinny, so these are also in our composite instruments, and then just a spoon as well. One thing to make sure we always have is a good pair of scissors. One of her biggest pet peeves is when the scissors don't cut, so we want to make sure we have a good pair there. And then as far as the forceps go, we always want an endo forceps. If you can see this little divot here, we want, a few pairs of them in each of these cassettes. Especially now that we're doing molar root canals, she's going to want one for each gutta percha point that she's filling with. So we will have some extra that me and Brenda will get put on the cart here, just in case you need some more. So you should have an extra probably 3 to 4 of these. Here we have our endo holder. So this is a prepackaged. We'll have these sterilized. So this is going to go into the holder, these little sponges, and then we're going to take out our files and put them on here. So we want to ask her at the beginning of the morning what size she would like on these sponges, and we'll have those prepackaged there as well. It is nice over here. Brenda has set up a rubber dam already. The frame, we have the rubber dam clamp here, and the forceps, and then the hole punch as well. So these are ready to go. We do have a root canal on Monday, so we're just getting this pre-set up. Here we have our apex locator. This is out for every root canal that we do, so she will utilize this quite a bit. So 2 different tips here. We have gray tip, and these are usually packaged together, so pretty self-explanatory. Gray to gray and silver to white here, so just remember gray to gray. And then to turn it on, we'll just hit the power button and it'll show up like this. So if the battery is getting low at a point in time, we want to make sure that we're changing the batteries in this, and I believe they take AA's, so we'll just always keep an eye on that. Here we have our sideband endo rotary. So this will also be on that card as well. So this you'll want plugged into the wall. These hand pieces are stored on the cart as well, so these will not be up where our regular hand pieces are. These are going to be stored with the endo stuff. Same thing, we want to make sure that the power is going to be on here. There is a switch in the back, so you can turn it off and on. So just make sure that that is on before she comes into the room. She will change all those settings on here if she wants to, but these are only going to be for the rotary files that I showed on the card over here. So these are the files that we'll work with on there.